The Care Quality Commission has overhauled the way it's inspecting providers of NHS services. My name is Will Hazell, and I'm going to take you through some of the changes relating to quality ratings. As part of its overhaul, the CQC has introduced a new system for rating providers, based on the 4-point system used by Ofsted. In future, after receiving a visit from the CQC, NHS trusts will be given a rating of either outstanding, good, requires improvement, or inadequate. To work out how to arrive at the right rating after an inspection, and to help the public see at a glance the strengths and weaknesses of a trust, the CQC has designed a colour-coded grid system. So here's how it works. Each time the CQC inspects a hospital site, it will review the same 8 core services, including, for example, A&E and maternity services. For each service reviewed, the CQC will ask the same 5 questions. Are services safe, effective, caring, responsive, and well led? Each service will be given a rating on the CQC's new scale for each of the 5 questions. The CQC will then aggregate the ratings to produce an overall score for each service. The idea is that if a hospital rates poorly on 2 or more questions, the service will get an overall rating of requires improvement. So when the CQC inspected Dartford and Gravesham Trust surgical services, it got good ratings for safe, effective, and well led, but requires improvement for how caring and responsive the service was. As a result, it got an overall requires improvement rating for surgery. While 2 poor areas will usually get a trust and overall requires improvement rating for a service, it's worth noting that the CQC has said it will exercise judgment when deciding what ratings to hand out. So it won't simply be a case of adding boxes together. After each service is rated, the trust as a whole will get a rating. So far, the CQC has awarded ratings to 3 of the trusts it has inspected. Royal Surrey was rated good, and like Dartford and Gravesham, Heart of England got requires improvement. So that's the new rating system. It's supposed to be simple and easy to understand, but as the Chief Inspector of Hospitals Sir Mike Richards recently told HSJ, who gets what rating could turn out to be one of the most controversial aspects of the new inspection regime. So as the CQC's inspectors continue their progress around the length and breadth of the country, you can expect to hear much more about these little coloured boxes.